Hello, I'm Dr. Craig Morton. As a board-certified rehabilitation physician, I treat thousands of patients from 12-year-olds to 103-year-olds, and by far the most common thing that I treat is low back pain. You may have seen some of our videos talking about back pain and causes of back pain, but today I'm going to share some information with you. You know, I'm sitting in clinic all day interacting one-on-one with patients, and they all ask me different questions, but a lot of the questions are the same. And I'm able to dedicate time to them, talk to them, look at them, show them what's wrong, explain to them what's wrong, answer their question. And many of them say, hey, no one's ever told me this before. No one's ever shared this much information with me. And so I'm hoping to take this opportunity to share some of the most common questions that I get asked and to give you the answer that I give my patients. And hopefully it adds value to your life. It's something that you can take with you, give you more knowledge, maybe share with your doctor, maybe make you more informed. So when you go to your physician or your chiropractor, your therapist, you're armed with this information, because the more you know, the more knowledge you have about your body, the better you'll be able to treat yourself, the more engaged you'll be with these treatment programs. And so I hope these questions add value to your life. I hope you get the answers you're looking for. If you need more information, if you're looking for more answers, you're looking for more solutions, be sure to visit the RehabZone.com for solutions to a lot of these conditions we'll discuss today. So the number one question: why do I have back pain? Or what's hurting? Well, to some degree, I'm going to need a spine model to show you what could be causing your pain. So I'm going to reach over, and I have an anatomical model. In doctors' offices, we often have models to show body parts, hoping that it makes it easier to understand. When it comes to the low back, this is obviously a very complex piece of anatomy. There's a lot going on here. This lumbar spine, where should I start? Let's make it easy. We all have 5 lumbar vertebrae. This is L1, 2, 3, 4, 5. These are your backbones. Between each bone, there's an intervertebral disc. This is the cushion or the shock absorber between the bones. Whenever we flex forward, you can see that the discs compress. If you look behind, there's 2 joints per level. The joints are the little bones, kind of like your fingers and your knuckles, that bend and twist. So when you bend and twist and turn, these joints are compressing and extending and shifting, and that's what gives you motion. The discs are your shock absorbers going forward. The joints allow you to extend backwards. All the nerves that control your legs, that give you sensation, that give you strength, come out of your back at different levels. Every nerve is responsible for a different muscle or a different part of your skin. Surrounding all of this is a bunch of tissue, fascia and ligaments that hold it together, and then around that is all the muscle that keeps your spine strong and resilient. The muscle is what's contracting to allow you to bend. And the muscles of the back attach to the hips, they attach to the pelvis. So when we talk about back pain, we can't just talk about the muscles of the back, we have to talk about the muscles of the hips and the muscles of the pelvis, because they all have to work together to keep your spine in optimal balance and posture and to ultimately decrease pain. It's very important to make sure the right muscles are strengthened and that the tight muscles are loosened just enough, because without that proper posture and balance, it will lead to abnormal stresses on these structures and ultimate pain. One of the big things that Carl addresses in the RehabZone home exercise DVD program is which muscles do we have to target and stretch to take pressure off the spine? Which muscles are we trying to strengthen? And I'll teach you about some of these muscles today. All of the parts of our body, as we know, can break, they can tear, they can wear out over time. When this happens to our back, we have pain. But when somebody says, hey doc, my back hurts right here, what is it? Well, let's see. If I put my hand over this part of your back, let's see, it could be either 1, 2, 3, 4, 5, 6 different joints, 1, 2, 3 different discs, 3 different bones, 6 different nerves, all the fascia, ligaments, and tendons and muscles supporting it. So I say, I don't know, maybe one of 20 different problems. There is no one quick solution when it comes to back pain. So the intervertebral discs can wear out over time. They can dry out over time. They start to lose that integrity, and they bulge and they crack. And people come in often and say, I have a bulging disc. And I say, congratulations, we all have bulging discs, because that's what happens naturally over time. But sometimes those discs can push even further, and that's called a disc protrusion. If it really blows out, that's called a disc extrusion. And you can see this model shows this highlighted by this red material. That's a disc extrusion. That material, that gel in that disc has oozed out. Not only is that causing pain in the back, it's probably hitting one of these nerve roots, leading to leg pain or sciatica. And we'll talk about that a little bit later. Over time, these joints can wear out, just like a knee joint or a hip joint or a hand joint. Those joints, as they wear down and the cartilage in that joint narrows, the bones start to grind and it starts to hurt. The problem is it's rarely just one joint, it's often many joints. And this can lead to pain. The muscles that support the spine can be under stress. When you stress a muscle, it puts stress on the tendon holding that muscle, and that's called tendinitis. Tendinitis can lead to inflammation of all the little supporting cushions in the hips, and that's called bursitis. So whenever we have back pain from extending, that's typically pressure from the joints, and that's why our back hurts from the joints. If it hurts to bend, we're putting pressure on the discs, and that's usually from your disc. Granted, any of these structures can cause pain with flexing and extending, but I just wanted you to get an idea of how a back is made up, some of the more common structures involved in the lumbar spine when it comes to injury and inflammation, and we'll get into a little detail later down the road about specifically what happens to each of these structures and what they feel like specifically. Look more at the RehabZone.com. We have a program that lets you do a self-assessment to yourself and put you through certain moves to identify which of these structures are causing your pain. I hope this short video is informative, and I look forward to sharing more questions with you.